Our next presenter is Lindsey.
Hi, I'm Lindsey, and during this presentation, we're going to be talking about birth and the common medical interventions that happen during, and also what those effects are on the mom and the child. This research is based off nursing, and the first rule in medicine is to do no harm. And I have some information here, and it says 90% of people giving birth received at least one medically unnecessary intervention, and 17 maternal deaths for every 100,000 in the US, compared to those in other high-income countries, and that's 700 a year, and that is a lot higher than other countries. My first article is low interventional approaches in intrapartum care. And a few things about this article is it's a questionnaire that included 185 hospital staffs, and they answered 148 questions. Some of the strengths of this article is that it did provide detail about the interventions and the data surrounding those. But one of the limitations is that it was performed in one state, so it's a little limited, and the questions were based on a self-report rather than an objective study. But the purpose of this article was to assess how frequently interventions were used during birth, and some of the interventions included fetal monitoring as well as pain management. And the survey used a point scale. It gave 1 point to no medical intervention and 5 points to interventions were used almost every time. The study concluded that the hospital always had an IV placed and always used fetal monitoring during labor. The results also concluded that hospitals with lower intervention rates had lower rates of C-section as well as episiotomies compared to those with higher intervention rates. However, there was no significant difference in maternal death or newborn complications. For the second article, this one focuses more on the child as opposed to the mother, and it included 590 women and their children, and the health was followed from the years 2000 to 2013. Some of the strengths in the study was that it assessed many possible interventions and a wide range of outcomes, but the limitations were that some of the findings could be contributed to unmeasurable variables. Like I said before, this one focuses more on the child, and it followed them the first 28 days of life. And the data that it collected was from low-risk women who gave birth in hospitals in Wales and Australia. The participants in this study were women who had no pre-existing conditions, they did not smoke, do drugs, they were between 20 and 35 years of age, and they gave birth to healthy full-term babies. Some interventions that were documented were augmentation of labor, which is basically giving Pitocin to help speed up the process of birth, and also breaking the mom's water. This study concluded that 43% of the participants were induced, 88% of the participants received pain medicine, and it also concluded that infants born to C-section experience significantly higher odds of jaundice, feeding difficulty, and low body temperature compared to those that were born via natural vaginal birth. The study also included that these children were followed up at about 5 years of age, and there was a 14% increase in asthma, as well as these effects did cause immune problems in the children, both short-term and long-term. For the third article, this one compares home births versus hospital births, and due to the environment and limitations, home births have far less intervention compared to those in hospitals. The study included 139 articles in 23 studies, and over 1 million women were included. But there was limitations to this study because it was funded by a midwife grant, which unfortunately can lead to some bias since most home births are led by midwives. This study included a wide range of interventions such as vaginal births that use forceps, C-sections, epidurals, and also episiotomies and Pitocin. Some of the effects were documented was postpartum infection, hemorrhage, and 3rd and 4th degree tears. And also death was documented in this article. One of the most important findings in the study was women who gave birth at home compared to those who gave birth in the hospital were 40% less likely to have a C-section, 50% less likely to have forceps used, and 55% less likely to have an episiotomy, and also 40% less likely to have 3rd and 4th degree tears. These women also were less likely to return with postpartum infections and postpartum hemorrhage, which is a common cause of postpartum death. For the fourth article, this one focused more on the emotional and psychosocial aspect of birth. It was a questionnaire from one private hospital with 331 women were included. Like I said before, this one was more emotional and psychosocial based as opposed to the other ones that are more physical based on birth. And the limitations were it was limited to just one hospital, and the questionnaire was given directly after birth, so that could affect the way that women answered the questions. The first part of this questionnaire assessed the mother's characteristics. The second part assessed interventions. And the third part assessed how the mothers felt about the birth and what their expectations they had before. Most women would consider a positive birthing experience to include support from the doctor and medical staff, as well as a healthy baby and easy recovery. And all of this was addressed in the study. It said that 75% of women in the study reported the birthing room was too crowded and the positions were uncomfortable, and 66% of the women stated that they received only partial emotional support from their doctors. And it was also stated that only 25% of the women giving birth was included in the decision-making process. These negative birthing experience was said to lead to difficulty feeding the baby, postpartum depression, difficulty with mother and baby bonding, as well as fear of childbirth and wanting another pregnancy in general. And since the emotional part of birth is a big aspect that people don't look at, that's why I found it important to include this article. And for the final article, this one is about the long-term risk and benefits associated with C-sections. This was a systematic review and meta-analysis that included 80 studies assessing long-term risk of C-sections on both mom and the baby. This study included over 300 citations and 57 papers, but only about 80 studies were included in the end. It compared natural vaginal deliveries to C-sections, and it said C-sections were associated with increased odds of placental abruption, which is when the placenta breaks away from the uterus and can cause the baby to have decreased oxygen and for the mother to bleed to death. It also caused increased odds of further miscarriages with different or other pregnancies. When it comes to the effect on babies, it concluded that C-sections had an increased odd of wheezing in childhood and also an increased odd of childhood obesity. And finally, all 5 of these articles pointed to the same thing, that minimal intervention for mom is best. It causes a happier and healthier pregnancy and also a healthier child. And this pertains to nursing, that we are as nurses, you are the patient's advocate. And if you are more educated on what's best for the nurse, then everyone's going to be happier and healthier in the end. Any questions? Okay, thank you.